Well, good morning. My name's Susanne MacGregor. I'm an honorary professor at the London School of Hygiene and Tropical Medicine, but I'm also emeritus professor here at Middlesex and attached to the Drug and Alcohol Research Centre. So it's my pleasure to be chairing today's proceedings, and I think we're going to have a really interesting couple of days. This is, of course, a momentous occasion marking the end of a 3-year project, the EPPIC project, aptly named, on exchanging prevention practices on polydrug use among youth in criminal justice systems in a number of European countries. And it's also a rather melancholy occasion because it's the end of a project which has been funded by the European Union. And we in the UK may not see their like again. So let's hope that this will be a wonderful rounding off of a series of European Union funded projects that the UK has been able to participate in. I have a few housekeeping notes to begin with, and then I'll introduce the speakers. You see there that we can have access to the internet. To do that, you go on to Middlesex Open, and then you can use the Twitter account, which is there on the screen. The proceedings are going to be live streamed. If anyone objects to that, do we have brown paper bags for people to put over their heads? I don't know. Maybe sit behind a pillar if you don't want your face to be seen. There's no fire alarm practice scheduled, so if we hear the fire alarm, please walk briskly out of the building, out through the reception and out onto the main road, and I think marshals will be there to tell you where to assemble. The toilets are to the left, along here, very grand toilets, because this is the area of the university frequented by the powers that be, so enjoy it while you can. There are a number of stalls which show evidence of many of the practice-based approaches which are part of this whole project, and indeed the whole aim of the project of the conference is to report on the research findings, but also to provide an occasion for networking and for learning among researchers and practitioners. So please do look at the stalls which extend all the way across, some on this side and some on the other side of the mezzanine, if that's the correct expression. And then finally, would you remember to fill in the evaluation forms at the end of today if you're not coming back tomorrow, and tomorrow also. So to begin with, I'd like to introduce Professor Carmel Clancy, who is the head of the School of Education and of Health and Education, and will welcome you to the university and to the conference.
Thank you, Sara. Thank you very much. Should I use that, or I'll start here, I think, although with many mics, I think, up here as well. So, let me see. I think that's on. I'm told I have a loud voice anyway, so I might not need the mic, but just in case, those at the back, can you hear me all right? Wonderful. So, welcome, and thank you, Susanne, for the introduction, and thank you to colleagues for allowing me to come and just spend really 5 minutes, and no more than that, because you have a busy day or day and a half ahead of you. But just to sort of formally welcome you to the campus and to Middlesex. Is this a first visit? Anybody a first visit? Ah, a few first visits. Oh, you're very, very welcome then. And hopefully the storm has stayed away for a moment. And I think you're actually quite brave as well to be travelling, because I know that people are really quite anxious at the moment. So thank you for getting here, because although we're smiling about it, I think there is actually a general sense of unease about what's happening with this dreadful global virus that people are concerned about. But hopefully we can put that aside and focus on what is a celebratory event in terms of the EPPIC project. I have to congratulate you for the work that you've been doing. I've seen some of the output, and it is truly amazing. My professorship is actually in addiction and mental health, so I'm one of you, actually. I'm also part of the DART team. and I'm very proud to be so. My background is nursing, and so I'm also the president-elect for the International Nurses Society in Addiction, which is having its global conference in Calgary in Canada. So I really sort of get, I suppose, how important it is to connect globally, and particularly at a European level on these issues, because we have so much to learn from each other, and that's clear obviously from the output from your project, and I think everybody's going to be immensely grateful for the work, and I'm really loving particularly that small sort of pamphlet that's been produced, because it just kind of hits those messages, and in busy lives and with very important messages to give, I think you've done a great job in being able to present it like that. But just to say, the faculty, which our school is in, is called the Faculty of Professional and Social Sciences. And I mention the faculty, not just the school, because the faculty also has two other schools, the School of Law and the School of Business. But within the School of Law, we have many of our colleagues who also are in DARC. And Karen, of course, is one of those leading lights from that school. So we are a collective within the university who pay attention, I suppose, to the issue of addiction. And I have to say, are engaged in quite a variety of projects, obviously the EPPIC being just one of those, and an important one. But colleagues, particularly from DARC, if you're not familiar with our Drugs and Alcohol Research Centre, you know, the acronym DARC is, I always thought, kind of interesting, because some people might suggest that addiction or drug use or alcohol use is a dark subject for some people. So maybe, I don't know, Betsy, was that the idea? I don't probably think it was. But there was no pun intended, just so that you know, if it's a new acronym for you. But just to say a little bit about the centre, because that's really where the work is being drawn from, particularly today. So the DARC Centre has three key aims. It's to conduct research able to inform policy and practice, as well as contribute to knowledge and understanding. To promote what we call the golden circle of link to research, teaching and knowledge exchange. And I think for any of us who work particularly within university or training institutions, we get the real importance of the applied research, and particularly for me, the issue of workforce development. I'm sure if your experience is similar to the UK, we are really not preparing our workforce sufficiently. There's real gaps in the workforce in terms of knowledge, and certainly in terms of education and courses. And so it's almost that people are going to do education after they've done some of their basic training, particularly nurses, doctors, psychologists, OTs, and so forth, which is ludicrous in the 21st century. So I think anything that can drive information, and particularly some things like the output from EPPIC, is really important, because as educationalists, we have a huge duty of care to make sure that that gets bedded into curriculum. So that golden circle is really, really important. And of course the third, and this is a very lovely example, is to establish local, national and international partnerships and collaboration. The research has a strong focus on European cross-national studies, of course, which this particular EPPIC project represents, but they've also, and the DARC has also participated in major European projects, including Alice RAP, which was Addictions and Lifestyles in Contemporary Europe, and the RAP, which was Reducing Alcohol-Related Harm. National level research includes work on contingency management approaches for drug users, and the use of alcohol IDA, identification and brief advice, and its approaches by the non-clinical professionals in issues around diversity, in particular gender and black and minority ethnic groups. And then, as you know, the EPPIC project has now actually given rise to a small study which will be looking at literature review and an overview of models of diversion out of the criminal justice system for young people. We have doctoral students who are currently researching alcohol treatment in prison and reconviction rates, and the role of peer mentors in alcohol service delivery. And DARC contributes, of course, and quite rightly, to teaching at undergraduate and the postgraduate levels. We run a dual diagnosis master's program, if anybody's interested in talking to colleagues while you're here. So you would expect me to do a little bit of business while I'm here to try and push some of our programs, but it is distance learning, and Rachel is shaking and saying, yes, please let people know, as our program lead. And we have been fortunate to have committed partners in the UK, obviously Austria, Denmark, Germany, Italy and Poland, and we've learned a great deal from each other. So the papers today present only a fraction of the rich data we have collected, and although only one or two people present the papers, they have been produced through team efforts, and I'm sure that that will be really important for people to understand and obviously recognise. I have to say, you know, as I say about my own sort of international connections and how much I fondly sort of embrace those and really understand the impactfulness of meeting colleagues from different countries and recognising somehow that addiction, and I think, you know, I'm speaking, as we say, to the choir in the church today, because I think you all get this, but that addiction doesn't know any boundaries, be those social, economic, geographical. And I think, therefore, there is a common sort of thread that we all can learn from each other, albeit that there may be some cultural, transnational issues, but ultimately at the core of it are the people. And that's why we do, I think, what we do. And I think that, you know, this sort of network and collaboration is so important. And, you know, Susanne, you gave nod to the fact that this is also quite a melancholic sort of day for those of us in the UK. It would be probably remiss not to mention the elephant in the room, in that this is possibly, maybe, at least from a coordinating point of view, one of the last projects that at the moment, until sense perhaps prevails, that we would be in a coordinating role. And I was sharing with Betsy just before I started, and I said, am I allowed to joke about Brexit? Given that we have so many of our lovely European colleagues here, and would it be allowed to joke about Brexit? But I actually said, you know what, we are actually really quite sad, a lot of us. I don't know if any of you are picking up my accent. I'm actually not British, I'm Irish. So I'm still a European. Yay! So, and I'm holding on very tightly to that passport. And in actual fact, I have family members who work in the Irish passport office, and you can't imagine the amount of people that are all looking at their ancestry at the moment, wondering, I'm sure I must have a grandmother somewhere in the background who will be able to sponsor me, and they're all looking desperately at their heritage and their ancestry lines, and I'm sure that's actually true for other countries. But I thought I might just, you know, so that we don't get too depressed about it, but I thought that I might just share two jokes. And just to start us off on not being too sad. So the first joke, which is appropriate given I'm an Irish woman and Betsy is a Scottish woman. So I'm sure many of you have heard that there is the jokes called, there was an Englishman, an Irishman and a Scotsman. Has anybody ever heard of those jokes? No. So I will share one with you. An Englishman and a Scotsman and an Irishman walk into a bar. The Englishman wanted to go, so they all had to leave. And then the final one, given we are at an addiction-related conference, is, and for those of the people who are millennials really, I'm certainly not in that bracket, but Brexit was like, it was like the UK got drunk and accidentally unfriended Europe on Facebook. So that's all to be said, but just that if we don't hold on to our sense of humour, I think then we are all lost. So I wish you all the best for the next day and a half. The programme looks extremely exciting. There's clearly such rich data to be shared. And I really wish you bon ami, I wish you happy collaboration, and may this not be the last European collection, particularly for Middlesex, to be part of. So thank you very much and have a lovely time.
Thank you, Carmel. She can be cheerful, she's Irish, you know. I'm going to reactivate my Scottish connection, so when Scotland becomes independent, all will be well. Okay, so to introduce to Betsy Thom, who needs no introduction. Betsy is the person who founded the Drug and Alcohol Research Centre and built it up over many years. She also built up the journal Drugs, Education, Prevention and Policy, and is a leading figure in the research on both drugs and alcohol. She's Professor of Health Policy, and she was the joint coordinator of the EPPIC project with Karen Duke. And of course, one of the interesting things about the project is that it brings together a whole number of participants from different European countries, but also from different disciplines. And I think Betsy is going to tell us all about the project. So over to you.
Thank you, Susanne. I don't have any jokes, but I am applying for German nationality, drawing on my ancient ancestors. So hopefully I will be able to stay European, but it's fingers crossed at the moment. I don't know. So what I'm going to do today is just give you a brief overview of the project as a whole. Some of you will have heard all of this before, so you can have a small sleep if it's very familiar to you. The project was funded from 2017 till February 2020, so we're nearly at the end, apart from the reports to the EU, supported by the third EU Health Programme, by CJS in particular. It takes place in 6 countries, and we have partners in the UK, 2 other partners besides Middlesex, Change, Grow, Live, which is a practitioner-based partnership, and also coming in after we'd started, but very welcome, from the Scottish angle, was Health Opportunities team in Edinburgh. Then we have Aarhus University in Denmark, Eclectica in Italy, the European Centre for Social Welfare Policy and Research in Austria, Frankfurt University of Applied Sciences in Germany, and the Institute of Psychiatry and Neurology in Poland. So we've been very fortunate to have this spread of partners, many of whom we've worked with before, so we've been able to work very well together. We had 3 main objectives. The first one, to gather knowledge, exchange best practice, and identify any transferable innovations or principles of good practice on interventions to prevent illicit drug use or the development of polydrug use and the use of novel psychiatric substances among young people in touch with the criminal justice systems of our various countries. The second one stems from the first, to develop a set of guidelines, principles or tools adapted to the development of initiatives aimed at the target groups and based on the EPPIC, the European Drug Prevention Quality Standards, which had been produced earlier by the EU. And thirdly, and importantly, to try and initiate a European knowledge exchange network for the practitioners and other stakeholders who are working with young people in the criminal justice systems. Our target groups were young people aged 15 to 24, although in reality we have a few that spread beyond that, so we've got a few at 14, I think, and up to 25. They had to be in touch with the criminal justice system, which meant either in prison or in other secure settings, but they could be in a range of different sorts of community-based projects or programs, in rehabilitation centres or in treatment services. We also targeted the practitioners who were working with this group of young people, and they're also a very wide group. They could be drug workers, prison officials, probation workers, youth workers, educationalists, health workers, or anyone else working with young people. And other stakeholders who were, in a sense, so far, a secondary objective to reach: national and local policymakers, service commissioners, and the voluntary groups working with youth and families. We found that we were including the latter group of stakeholders within our advisory groups in the different countries. So we had to think, what do we mean by prevention when we talk about this young group of people? And we knew from the start that it was not going to be a straightforward say no to drugs type of prevention. The work ensured us that we were actually quite right. So here are just some of the comments that we got. Some of them have been smoking weed since they were 12 years old. We do work on ones who are 15. They're already 2.5 years down the line. So I think prevention may be too late then. It's more about damage limitation. That's from a substance use worker in the UK. Then from a young person himself, people aren't going to stop doing it, but you have to find a way for them to do it safely. And then another aspect of prevention which we didn't build in initially but which emerged from the data, and that was involvement in the supply chain. There's definitely a gap for effective intervention around supply, because if they make loads of money, if they're helping their mum out, they're not really getting caught, and if they do get caught, it's fairly light touch, because that's the whole point of trying to stop kids from becoming entrenched in it. That's from a youth worker. So that's the sort of breadth and spread of prevention issues that we had to incorporate within the project. So drawing from one of our work package reports, this is the prevention definition that we actually used. This, at a simple level, drug prevention may include any policy, program or activity that is, at least partially, directly or indirectly, aimed at preventing, delaying or reducing drug use and or its negative consequences, such as health and social harm, or the development of problematic drug use. So that broad definition was taken up by the partners. It's incorporated in the country reports and in the cross-national report. Therefore, we framed everything as widely as we possibly could, and our samples included some young people who were not terribly affected by their drug use, were right at the beginning of experimentation, and others who had been quite heavily affected by drug use. In order to do the work, we had 7 work packages. The first 3 were management, dissemination, and evaluation. The dissemination package was managed by our Austrian team. The management was by Middlesex, and the evaluation work package is led by our external evaluators at Ghent University. But the meat of what we were doing comes in the 4 work packages here. So work package 4, which was led by the Polish team, was looking at knowledge exchange on current evidence and practice, and we had a whole host of ways of getting at that, which I'll explain in a minute. Work package 5 was a large work package, and we split it into 2. So in the first part of that work package, we looked at a variety of interventions aimed at this particular group of young people, and we focused on innovative interventions. People who were practitioners who were trying to do something different and new. And that part of it was led by the Danish team from Aarhus. The second part of the work package 5 focused on the young people themselves and the practitioners working with them, and gathered evidence through interviews and other means of their trajectories, their pathways into drug use and through drug use, and their pathways and how they became involved in the criminal justice system and what happened to them throughout their lives there. So that is a large work package. The second one was led by the Italian team. Work package 6 was an important work package which was built into our bid for this project and was required by CJS, and that was to produce guidelines for good practice and quality standards which were based on the EPPIC, but specifically to look at this group of young people. And that work package was led by the German team. And finally, a small work package looked at how can you transfer or translate these different types of projects and interventions and approaches from one context to another, from one country to another, but also within countries, from one place to another. And that work package was led by Middlesex. We used a variety of methods, all of them qualitative. I won't go through it in detail, but you can see that we had literature reviews throughout. We produced descriptive reports of the context of all of this. We were very aware that practice and our young people's opinions and the services that they were experiencing were all located within different legislative structures, within different regulations, and that was important to understand. So WP4 aimed to have a look at that. In WP5, we were interviewing young people and practitioners, and we had to develop common tools to do this. We developed tools throughout the whole project, but particularly importantly for WP5. So our interview schedules, our coding approaches, and our analysis guidelines were all similar for all the teams. In WP6 and 7, we were again and used workshops, discussion groups, and individual interviews with key informants and a variety of stakeholders. We included our advisory groups in these workshops and discussion groups because they were important, because they provided a view of what was happening at the top levels. And then our knowledge exchange network, to try and forward that, we used websites, we used country-specific workshops and discussion groups. And I will say now that it was problematic. We expected it to be, but it was very difficult to get a European exchange network off the ground and active. So we've had more or less success with the country ones, but less success with the European ones, and that's something we can take up later in the project in discussion. Writing up and use of terminology. One of the things we had to agree on was how are we going to talk about our results. And it's very difficult because everyone uses different terminology in their different disciplines and in their different countries, and some terms don't always translate the same from one country to another, one language to another. So we did have a general agreement that as far as possible we would try to use non-stigmatizing and non-labeling terminology, and to use a people-first approach. So, for example, we talk about young people in contact with the criminal justice system, or we talk about young people who use drugs or who are drug experienced. Sometimes it's rather a lengthy way of describing it, but we thought it was better than the opposite. And we try to avoid certain terms which I've put up there, so that we had this common, respectful language for the people that we were researching. Our outputs. We've had quite a number of outputs. We've had a lot of national reports and cross-national reports. You can see we've had 6, 12, and 6 from the different work packages. So you can find all of these on the EPPIC website. We've had some academic publications, 5 papers already published in Drugs and Alcohol Today, 1 paper in Journal of Youth Studies, and we've got 5 papers which are under review in Drugs, Education, Prevention and Policy. The ones that are under review will eventually be open access. The others are not, so if you want to get hold of them, you have to write to the authors. I'm sure they can send you a copy, but you've also got the abstracts in your documentation. Then we have had a number of other outputs. So, for example, we've had the Danish team have put articles in their practitioner journal Stoff. We've had a number of blogs in various places. We've had short reports and briefings, and quite a lot of these are up on the EPPIC website as well. So we have been quite busy, I think, or it felt very busy. So, some key findings, just to give you the flavour of some of the papers that you're going to be listening to. And what we have done, I'm talking about them in the order of the papers, not necessarily in the best order. The findings, we've got findings at the individual level, and one of the things that comes out most clearly from every country is that most young people who are drug experienced and in touch with the criminal justice system have a range of very complex problems. These problems include mental health issues, social difficulties in the family, the home, the school. Therefore, responses which are aimed to prevent or reduce drug use or crime involvement, they will not be effective if other problems are not addressed properly. To give you one quotation, emotional well-being is just horrific, and also the kind of troubled family, extensive amounts of disaffection within the family. Essentially, every client that we have now has a number of issues, of which substance use is one of them. We're not a substance use team anymore, we're an emotional well-being service with a specialism in substance misuse. And I think that was typical of a lot of comments. Apart from the individual level, where most of the projects we were involved in, they were targeted at individuals and individual change, we had to take account of the structural level, as I said, and how that can influence what practitioners can do and what young people receive. So from our research, we have concluded that wider structural change is needed in order to address the systems and socio-cultural factors which are associated with problem drug use and crime. Delivering interventions and services within criminal justice context places several ways of constraint on what the practitioners can offer young people. So that is a major difficulty that came out of our work, and you will hear more about it. The criminalisation and stigmatisation of young people makes it more difficult for practitioners and the young people to build up social roles for this target group and to develop a positive social self-identity. So these are issues that will be talked about more in the work to come. To quote one person from Italy, it's hard when you leave prison because even people who know you, my Italian friends, looked at me differently, did not trust me, because in the end, prison remains the place of criminals. Again, a typical kind of comment. Then at the organisational level, which a lot of our work was focused on, the relationship between practitioners and the services and the young people. And what came out again from many of the papers was that you need a holistic and interagency approach to deal with the complex problems. This is not new, we've known that for a long time. Partnership working within the criminal justice system and good transition services between prison, secure units and returning back to the community are an essential if you are going to tackle the problems that we have identified. A second issue that was very prominent was that agencies need to find appropriate and effective ways of engaging the young people in the interventions that they offer. And we've produced a very short leaflet about that, which came out of some workshops in the UK. So building relational aspects of service and intervention delivery and fostering trust between the service deliverers, the project providers, and the young people are key elements of engagement. Again, that will be discussed in a later paper. So from one young person in Denmark, it's so annoying to go somewhere for help, and then you're passed on to another place. In the end, you give up. You feel like an idiot. So these are some of our main findings. We're also looking, as I said, at transferring. How do you transfer what we think we've identified as good practice and good principles of good practice? There are different levels at which you can look at transferring what we've learned. There's the policy level. As I said, we've recognised that the structural factors are important. Poverty and deprivation were huge issues that came out of what the young people and the practitioners were saying. Homelessness, unemployment. The immigrant status came out very clearly in Austria and in Italy and is also important. Unequal access to resources in general. So transferring policy models needs to be much broader than just looking at policy within the criminal justice system or even within health. It has to look at education and social welfare as well. Then at the organisational level, as we said, partnership issues are really important. So we need to look at what organisational models of good practice do we have. Maybe partnership working, but we do know there's lots of difficulties with that, and particularly working in partnership between the criminal justice system and social welfare and health organisations. Different issues in different countries, but as an issue it is important. Then at the practice level, if you want to transfer innovative practices and projects such as we have found, how do you do that? How do people decide what is suitable within their context? And this has been the focus of the work we've been able to do in our work package 7. So we've looked specifically at transferring projects and programs rather than looking at the organisational and policy level transfer. We just want to recognise that those are important. The projects that we did look at in EPPIC, it's very clear that they were based mainly on individual change theory and individual change responses. So they were using counselling, the provision of practical support, for example, looking at general health and welfare needs, and they were focusing their efforts on that. And that is one way, that seems to be the main way of looking and trying to help these young people. There is, however, another way. We can look at changing environmental contexts, and we can do that either at the national level or at the local level, taking a systems approach. This has been done very much in the alcohol field, and it goes back a long way, at least 20 years, to looking at how can you tackle systems change at the local level. So with that idea in mind, we have invited one model, just as an example, the Icelandic model, which has created a lot of interest recently and quite a bit of debate, I think. We've invited someone to speak about the Icelandic model and to talk about how they're trying to assess its suitability for running it in Dundee, which is a town in Scotland, very different from Iceland, and so that comes in there. So transferability is an interesting and very difficult issue. Then, of course, we come to one of the main things we had to do, develop the quality standards. You will get a detailed talk on this, so all I want to do is to flag up that quality standards, like the projects, have to be spread across very different systems, very different cultures, very different contexts. So it's very difficult to produce something that can be applicable to everybody. And of course, when we discussed it with our various teams and in our different countries, we got a lot of comments about the problems that they would encounter in trying to use a standard set of quality standards. So what we had brought up, for example, diversity issues. How do you make it suitable for different ethnicities? Coping with different language issues, such as was found in the Austrian situation. What about the cultural clash in different therapy contexts? So that was one issue. Then there was the issue of what's the baseline of evaluation in a country? So quality standards imply that you have a way of evaluating and looking at your services. But from Italy, there came the comment that there's a lack of evaluation practice in prisons and in community addiction services. There's a general lack of an evaluation culture, so that needs to be put in place. Then, of course, in the UK and elsewhere, we were very aware that services for this group of young people are very fragmented. They're scattered across a whole lot of organisations and a whole lot of health, welfare, education and criminal justice systems. So how do you produce something that's suitable for the practitioners in all those different contexts? That was brought up. Also, we had the comment from Poland that you need to shift the attention away from a narrow focus on drugs, and that you need to apply to them to prevention and treatment and rehabilitation. And that links back to what I said about prevention, because this group of young people has such a wide range of needs that if we take a very narrow definition of prevention and prevention standards, it doesn't cover some of the needs. Finally, from Denmark, we had a comment that certainly applies in the UK and probably elsewhere. Professionals generally did not know whether their organisation operates with quality standards. And I think that's true. When we asked people, have you heard about the EDPQS? We gave it its full title. Most people hadn't. And then when we explained it to them, and we did do a short discussion group and showed them what it was all about, they were not sure that they could use it because it's big. So there are a lot of issues that we will need to discuss when we discuss the quality standards that we've produced. So that's about it, except to say that EPPIC hopefully is not the end of the story. We do feel that there's a lot that can be taken out and continue from the project in the different countries and hopefully beyond. We've already got a tiny research project, as Carmel mentioned. We're going to be looking at diversion out of the criminal justice system for young people in the UK. And if anyone wants to link in and do it in their country, you'd be very welcome. We would like to look at practice in more detail. What's happening in practice? How are they managing and looking at the idea of quality standards in their own situations, and what evidence can come out of practice? Rather than having evidence that is from the top into practice, we need to look at evidence coming out of practice. And of course, policy. We need to see ways of getting our learning from the EPPIC project into policy streams. So hopefully that's just set the scene, and the papers that you're going to hear will be giving you a lot more detail on all of these issues. Thank you.
Thank you very much, Betsy. Gosh, I mean, you can see the amount of organisation that must have been involved in keeping all those work packages and countries and disciplines together. So, thank you very much. So now we have the Italian team. Franca Beccaria and Sara Rolando represent the Italian team. They come from the research unit Eclectica and have many contacts throughout Italy, and I think are leading researchers in Italy, critical and I think quite independent researchers and have a reputation as such. So we're going to hear from them about young people's trajectories. Thank you.
Thank you, Susanne. Can you hear me? Yes. Okay. So we are talking about one part of the work package 5 about the trajectories, and which were the objectives of this work package was to investigate and describe the drug use in trajectories of young people in touch with the criminal justice system, to identify factors associated with onset, continence, cessation of drug use, polydrug use, and use of MPS, and understanding the relationship between use and, of a drug and offending behaviors. Betsy has already mentioned a little bit the trajectories method. So we define common interview guidelines. It's very difficult to do comparative research in qualitative research, so we had to be very strict in the definition of rules among partners. So we did individual interviews in all the 6 countries. We define a common coding scheme in order to analyze the content of the interview. We also define a common template for the report, so we produce 6 national reports and 1 cross-national report. The topic under investigation were the onset of consumption and especially changes and turning point factors of increase or decrease in drug consumption, drug setting, life events, and also the role of a criminal justice system. Meanings of consumption, self-control strategies and rituals, role of peers and relatives, physical and social environment, cultural and subculture's role, experiences and suggestion about intervention. We use a trajectory-based approach that was chosen as suitable to catch the complexity of the topic. The time span of the interview go from September 2017 to August 18. We invite interviewees to draw a graph and to comment, to talk on the graph, focusing especially on changes in their drug use and factor related to this drug use. So this turning point, as you can see from the draw, we use them in order to talk with our young people. It was not easy to get to the sample because obtaining of the authorization and recruiting interviewees was really difficult, and we got different difficulties in different countries. For this reason, not all partners were able to reach the number of 40 people to be interviewed. I don't go into detail of the sample, but as you can see, the sample is quite different among the countries in terms of age. It was more or less homogeneous, unlike Denmark, where that was not possible to interview minors, or in terms of having partners' children, but especially differences are, as Betsy already said, in the immigrant background. We have to keep in mind that this is not a comparative research, but a cross-national sample, which added value is to provide many examples of sub-samples characterized by different patterns, different social economical conditions, social context, different kind of measure due to to be in touch with the criminal justice system, different drug markets. Also, you can see from this table that also the measure applied to the young people that we interviewed were different among the country. In some countries, we were able to interview young people coming from different kind of penal measures. In other, less differentiation. For instance, in UK, most of the people came from prison or from alternative, especially from alternative measures. Like in Poland, there is a wider differentiation. So now we move to some results, the main results.
As you can understand, we collected a huge amount of data, so I will present you just some of the topics that emerge, but there are much more information on the reports. I will focus especially on two topics, drug use patterns and the relationship between drug use and offending behavior. To talk about drug use patterns, before entering the criminal justice system, a significant part of the sample had only used cannabis. Doses, of course, changed among interviewees and over time. However, many interviewees ended up smoking joints instead of cigarettes, that is, many times a day, and reaching in some cases 10 grams a day. Most interviewees consider using cannabis as a normal activity, a lifestyle, also because cannabis was largely available. Different kinds of pleasurable effects were reported, such as relaxing, disinhibiting, appreciating more intensively any other activity, enhancing performance, like school or job. Like you can read. Something said, I use it to make the brain work better. But the pleasurable reasons for smoking cannabis were often strictly associated with two main underlying negative motives, namely, first, perceived stress related to various problems with parents, school, partners, mental health problems, above all depression, but also aggressiveness and the need to cope with violence, loneliness, and or traumas. And the second is boredom due to an unstructured daily life. Indeed, many interviewees not attending school nor having a job describe their daily lives as mainly consisting of hanging around the streets or parks. Someone said to us, we smoke weed and sometimes one of us knows of an opportunity to make some money, or we do nothing, and that's too boring. I don't know what else to do. I'll leave you to read some quotation alone because you can read better than me. What about other drugs used before entering the CJS? In Denmark and Italy, the most commonly used drug after cannabis, and often used in addition to it in a combined use, is cocaine. Many reported daily use of cocaine, but most frequently cocaine was used only in social situations and together with friends. Use motives related to cocaine are being more active, enhancing atmosphere, avoid boredom, escape problems, relieve pain, and some young people also quoted addiction. They call it so, but this was referred mainly to crack cocaine. Cocaine was also associated with loss of control and offending. In some cases, they stated that it makes you brave and aggressive. And especially within the Italian sample, crack use was mainly reported by detainees. And many of them had been just caught during a peak in crack use, entailing 3-4 days of continuous smoking without sleeping. For what other substances are concerned, overall, only a minority of interviewees can be considered polydrug users. In most cases, the substances used were cannabis and cocaine, as I told before. While the use of drugs other than cannabis and cocaine was not reported as extensive nor regularly, with exception of Poland and UK. The use of new psychoactive substances was even less frequent, generally represented as risky and with negative effects, and therefore reported as used only once or occasionally. Reported new psychoactive substances were mainly synthetic cannabinoids and synthetic hallucinogens. Alcohol was almost always associated to the use of drugs, with exceptions of a subsample of only cannabis users. And here there is a quote about the effect of perceived effect of synthetic cannabinoids. Ever since I took Ching, I always took panic attacks. Since that, legal highs are really dangerous. But looking at the difference between data collected in different countries, we cannot get comparative meanings, but we can look at different patterns. And for instance, only in Poland, most of interviewees use other drugs besides cannabis, and mostly stimulants, above all amphetamines and NPS. Also, young people in the Austrian sample had occasionally experimented with NPS. Some of them, after buying them from the darknet, had also begun to deal NPS. In UK, NPS were associated by interviewees with the homeless and prison population, while in Italy crack use was reported with the same meaning. Heroin use was reported in Poland and Italy and UK. Stimulants like amphetamine, methamphetamine, speed, dissociatives, and or psychedelics were usually related to disco clubs and rave parties, and their use was associated with recreational purposes and to a less degree to psychonaut motives. Also, the use of prescription drugs were reported in Italy and Denmark and UK. Now let's look at drug use patterns when the people were in contact with the criminal justice systems. Three kinds of patterns were reported: quitting pattern, decreasing pattern, patterns and increasing patterns. Quitting patterns were reported mainly by detainees who represented the prison as an occasion to quit with all kinds of substances, something which is not easy outside, where drugs and troubles are constantly around. For some, this means not even prescription and substitution treatment. Indeed, many interviewees were critical with the use of prescription because they think that they are addicted as well as illegal drugs. For other interviewees, this contact with the criminal justice system was an occasion to be treated, to find treatment. For others, it was an occasion even to get in a job, and so it was like someone said, it was a lucky. Obviously, prison drug policy is another main motivator to stop using drugs because of the fear of the consequences of violation of this norm. By contrast, and this is worth mentioning, reasons to quit are not mainly related to availability. Indeed, young interviewees reported that drugs can enter prison and other alternative measures by different ways, such as leave permits, ingestion, corrupt assistance, and drones. Decreasing pattern drug use is the most frequently reported pattern across countries, and it was attributed to a function of the sentence, a decreased availability, or also maturation and free will to change due to negative side effects of use of drugs, including getting arrested. But usually, these decreasing patterns means using only cannabis and using lower quantities, or changes in substances. For instance, someone said that cannabis and tranquilizer are seen as more suitable for prison life compared to stimulants. Also, changes in substances were linked to the price of substances. For instance, in Poland, NPS, were reported to be cheaper and less detectable, and so mainly used in detention. We find also persisting patterns. Motives to continue to use illicit drugs in the criminal justice system are somehow the same as for using drugs outside it, with the addition of the stress directly due to being in this system. Having trouble with the justice system seemingly can increase or at least reinforce drug use in order to cope with the stress of not being free, to cope with solitude, to be able to sleep, to cope with boredom, especially in remand prisons, to have a good time with inmates. Many interviewees across countries, especially those under alternative measure, continue to use drugs either because they don't care about possible sanctions or because they do not consider this issue to be too important with respect to the final sentence and not harmful. This was reported especially with regard to cannabis use. Some interviewees did experience new drugs just in the criminal justice system, and this is also worth mentioning. Now let's come to the relationship between drugs and crime. This issue is one main issue debated since a long time, and a sort of self-evident concept which led to the development of the terms drug-related or drug-driven crime. Three main explanations were used to explain this complex relationship. The first kind of explanation is economic. That is, crime, for this explanation, mainly crime represents a means to get money to buy drugs. Second kind of explanation is pharmacological. for which offending is a consequence of impairment in cognitive function due to the drug use. Third, we can call it lifestyle or system explanation, which claim that crime and drug use are parts of the same system and culture. But we know that the connection between drug use and offending behavior varies by cultural context, by time, and by types of drugs. And this is the added values of our sample, because it provided us data about young people, which is not the main target usually when the previous research literature focused on older people, living in different countries and using different substances and adopting different use patterns. So the EPPIC data provide us new elements to think and rethink about these three main explanations. The economic explanation is still valid for some of our interviewees. Indeed, dealing cannabis in order to support its daily use was the most recurrent reported pattern, thereby calling into question the use of the addiction concept as a main explanatory model. If you smoke every day, you automatically need to smoke more and more cannabis to get high in the same way. I liked it a lot, but I couldn't afford it. I work for my stepdad and earn money, but not enough to allow me to smoke every day. Therefore, I started to sell drugs. This pattern is important to frame this in a context of normalization of cannabis consumption, which has led to normalization of supply in closed social network. And also we have to take into consideration that the aim of dealing can go beyond the original reasons once young people discover that it is so easy to make money. Like a young Italian interviewee said, after that, when I saw that to get money it was sufficient to do so, I became more obsessed by money than by drug itself. And so I want to spend a few words about the dealing experience. Dealing is not only about money, but something that gives young people respect and status, providing them with a recognizable role and boosting their self-esteem, like in this experience. I had serious problems with bullying before. Then I realized that the dealer was just almost a role in the school society. It is also a means of financial independence and self-affirmation in a situation of relative deprivation and frustration. Like a German interviewee underlined, who was doing a very badly paid work. You stand there 6 hours and you pack bags. But when you work for security companies, you earn 15 euros per hour. Well, 15 euros are better, but nevertheless, many opt for the criminal way. It's easier, it's faster, and nobody plays the boss who treats you like a dog. But in other cases, offending experiences, especially thefts and robbery or drug dealing, occurred before young people had used any kind of illegal drugs. And this was reported especially by interviewees living in deprived neighborhoods and subject to social exclusion, like in the case of an Italian interviewee who said, I did not have money for shoes. I went to school with perforated shoes and wet socks, so I started to sell hashish to buy a new pair of shoes, not for other reasons. What about the pharmacological model? There are many possible links, aggression, courage to offend, and judgment impairment that emerge by the data. related to many different kinds of drugs, thereby showing that it is not only a matter of substance, but also of doses and consumption styles. For instance, the quote is about amphetamine. And also impairment, it was not necessarily linked to a condition of addiction like it was emphasized in early studies and by the official view. Indeed, though boundaries between cannabis and other kinds of drugs were highlighted, we wonder if it would be necessary to review this concept of judgment impairment, since many troubles with the criminal justice systems happen just when the young people were under the effects, and in some cases under the effects of synthetic cannabinoids, for instance, as you can see in the UK in the last quote. And then we see the lifestyle model. Sometimes it is difficult to say, in most cases I would say, it is difficult to say if the use of drugs or offending come first, as they both originate in the same context or from the same need. So we have individuated two main kinds of situations. The first, when both behaviors can relate to economic and social disadvantage. In this case, dealing is the only opportunity at hand to get an income, and drugs become a means to cope with the deprivation and anguish of precarious lives. This was the case, for instance, as previously mentioned, of young illegal immigrants who cannot find a job, and so dealing become the only one opportunity to get an income and also to enter their community. When referring to deprived neighborhoods, not all the interview with reported family and or health problem, but almost all underlined the key influence of their peers and community in beginning to imitate these behaviors. However, it is important to acknowledge that using drugs and committing crime can become part of lifestyles among young people who are not necessarily experiencing economic poverty. And this sort of lifestyles includes the desire to maintain a sort of hedonistic lifestyles, often are related to a lack of concern for consequences of their action, and this is related again to the fact that the use of certain drugs is normalized, and they are often related to impulsivity and sensation seeking. Like a UK 20 years old boy said, by doing these crimes, I always had lots of money in my pockets, so I started to buy it often and use it. It refers to cocaine. Then, this is obvious. Having money in your pockets, you go to one place, to another, in nightclubs, you know, among alcohol and women. And another quotation is a key quotation. Robbery also brings adrenaline, and you can become addicted to it as from drugs. When I was counting money, I felt incredible euphoria. I stole under the influence of stimulants. I felt that nothing could happen to me.
Okay, to conclude, or at least to try to conclude, as you can see, it's really difficult having more than 150 interviews. Every time that we take in our hands the data, new ideas and new issues came out. So to summarize what Sara has in detail shown you, we can say that crime and drugs, we can find many connections possible, based on different substances, cultural context, economical condition, but none is sufficient alone, not fixed. We had a lot of data saying that drug and crime are related to poverty and to social exclusion. Offending actually is perceived as an obvious choice given the lack of legal income and opportunities. Use of drugs is seen also an alternative, a way to cope with pain, mental health symptoms, suffering related to complicated life condition. But we also found different degrees of exclusion. For instance, the relative deprivation that Sara showed very well with quotation. Young people today suffer from living in a bulimic society that raise aspiration and desire while promoting scarce opportunity for economic success and recognition. I'm thinking to Merton theories. We can see that clearly many of these young people are the innovative people that really share with the other the goals, but they decide to use the illegal means to reach those goals. And drug and crime, of course, are related to youth street culture too. So both offending and drug use as we can see as the outcome of certain attitudes that are part of the youth cultures, including the pursuit of hedonism and sensation seeking. So in both cases, drug and crime youth behavior are not only the result of personal choices. The result highlights the contradiction inherent in our societies where the use of certain drugs is prohibited, but also socially accepted and widespread, for instance, cannabis. Both issues need to be addressed at a policy level, as young people themselves suggested, and the intervention should aim to increase awareness and agency among young people. And you will find later the quality standard providing you some ideas, helping them to live in contradictory society. Finally, just 2 seconds saying a great thank you, because we are the first partner speaking after Betsy. So we would like to thank our colleague of Middlesex University for arranging this conference, but mainly I would like to thank all the group, the EPPIC research group, because we spent 3 hours together, very exciting, in doing a really exciting job, and so I'm happy really to be here today. Thank you very much.
So, would you like to sit here? Yes, you too, and Betsy also? Yes.
I'll sit, but most of the questions should be for them. We're arguing about who should go in the middle. But I think I was just setting the scene, and they've got all the important information and issues to discuss, so I think you're in the right place.
Okay, so, well, wonderful, wonderfully comprehensive and concise way of bringing together, obviously, a lot of information, and people will want to read the articles to find out more on the report, but questions and comments from the floor. I have the... I want to be the first person.
Yeah. Say who you are and where you come from.
My name is Kees Koos. I'm an honorary consultant at the European Center for Social Welfare Policy and Research in Vienna. Just to break the ice, so to say. First of all, congratulations on the summary that you did on the report of all these data. I think you did a fantastic job. My question is about the limitations. You already said that these are qualitative data, but can you say something about the limitations in terms of what have been the selection mechanisms that are behind these data? Were these people selected by the interviewers? Probably not. They were selected by prison personnel or by service providers. And why did they select these people and not others? Can you say something about the limitations? Because I think that is an important issue when we go out and say, look, this is what we found.
You raised a very important point, and maybe that Sara can complete my answer. Of course, when you deal with the people in touch with the criminal justice system, you cannot reach directly the young people that you wanted to interview. And so, as I briefly mentioned, we, in the different countries, we met different difficulties. And of course, this is the reason also that we repeat and we write in each article that this is not a comparative study, because we don't have the same sample. But we don't have the same samples, not because we decided like this, but because because of the characteristic of the sample. So we had to be very careful, we as a researcher in our countries, to contact the right person and also to reach the people to be interviewed. And this is, we try to be very serious in doing this, to use method, to share our difficulties, but of course then we have to accept this limitation. In my point of view, from my point of view, this limitation is also a strength. It's not only a limit, because it shows that this kind of population have so many limitations in terms to get access to outside, that of course when we do research we have to recognize this as part of the research. So it's already one result, in my opinion, this.
I would add a few words. Yes, first we basically interviewed people where the professional give us the permission. But in most of cases, fortunately, the number of minors in contact with the criminal justice system are not so huge. So in places where we were allowed to do interviews, we usually interview all the young people who were in our target. So where we can enter, usually we interviewed all. So there was not another kind of selection from the professional side. And another thing that I want to add, which is important in my view, is in a personal experience. I was in a prison in Italy, and the professional did this first selection to me. And then after I had started to interview young people, a queue was formed in front of the door where I was doing interviews, because in the first they had not understand the meaning of this interview, but after the first did it, went to tell other young people that it was so important and so nice to have a talk about their lives. And they were so keen and happy to tell their stories, and I found this very, very touching. And at the end of some interviews, they said, "Thank you for giving me this opportunity." So this is important to know, I think.
Thank you.
Good question. I have one additional comments from the perspective of Polish experience.
The mic is not on.
It's on, but maybe loud, you speak loud.
Okay, but I think I speak loud enough without the mic, so I'm sure that
Now it's on.
Now it's on.
How we did work in the prison. We had a meeting at the beginning with all prisoners in the ward, and we presented ourselves, and then they had the opportunity to ask questions, and in fact everybody agreed to participate. But my guess would be that some people who were having a penalty, being isolated, perhaps didn't participate in that meeting. So my impression was that we got less critical opinions than we could have got if we had access to all people. But nevertheless, it is worthwhile material.
Sure, absolutely.
Just to integrate what Jacek said, this is exactly the reason that in every country was different. In our country, it was not possible to organize that kind of meeting in the prison. So it was really not possible to have the same rule in getting the sample.
Reply?
Good.
Yeah, just quickly also reply to that question. I think one of the limitations, in my experience as a researcher here in that project, was also to explain our role as interviewers, to explain the role to the young person. Who are we? We are researchers, we are social researchers, but we also had to explain we have nothing to give them really. We have nothing to offer them really. We are not psychologists, we're not medical practitioners, we're not legal practitioners, we're not attorneys. So this was very important, as from my experience, very important to explain at the very beginning of the interview. What can they expect? Because as Sara said, sometimes they also were left alone after the interview. And we walked out, and I felt sometimes a bit sorry for them.
Yeah.
You know?
Yeah. Very good point.
On the British experience, we found it very difficult to approach young people directly. And in fact, we did use the practitioners who were working with them. And I'll base it on the Scottish situation, which I know best. We discussed with her, you know, the tools and what to do, etc. She was a trained counsellor. And the element that we found that was most important in getting interviews was trust. The young people trusted her, so they were prepared to talk to her. And then she was able to recruit other practitioners who knew her and had young people, and it went down the chain. So she was interviewing young people coming from other services and projects, and the trust chain helped to get those, to recruit those young people. So that was important in the UK situation, and the reason why in the end we did not use researcher interviews.
Hello, I'm Sunita Stewart-Toft from Public Health England. We're also a UK collaborating centre for the WHO Health in Prisons programme. Just some reflections really. So, you know, it was really interesting to hear from Betsy that we need to work around stigma and social identity, particularly on release. And I think I'm particularly interested in how we might do that for young people, because if we are going to, you know, stop the cycle of offending, you know, we need to think at that early stage. The other thing that I just wanted to reflect on is that we've been talking a lot about the methodology of working in a justice system environment and how we do research with people in that environment. And a shameless plug, I'm afraid, but this October we're hosting a conference in London under the Worldwide Prison Health Research and Engagement Network, so WEFREN 2020. And I think it would be really interesting to hear about some of the methodological issues that EPPIC has faced and how you've approached those. So, you know, I think it would be really good to see some abstract submissions for that conference as well, to consider those.
Plain stuff hard, drugs and alcohol today. Sara, Franca, thank you. I noted in particular your comment from one young person that they became more interested in the money than in the drugs. And I wondered if you had any picture of overall, amongst the young people that you managed to interview, how many of them were dealing and not using?
How many were dealing and not using?
There were some who start dealing before using, but I can't remember people dealing and not using. Because on the contrary, it was several times underlined that when you manage and when the substances are at hand, you really get involved, and it is difficult to stay clean. And also, when you are a dealer, substances help you in facing some stressful situation and to overcome the stress of doing something which is not legal.
Yeah, just I'm not sure that we said clearly before. So not all our interviewees were dealers.
Oh, yeah.
So we were they were in touch with the criminal justice system for different reasons, included of course drug dealing, but not only. So we have a quite a relevant number of young people who we interviewed who were not involved in drug dealing, but they were drug experienced person.
Most of crimes were about burglaries and thefts, robberies.
But some also homicide.
The inclusion criteria was used.
Yeah.
Yeah.
Hi, thank you very much. My name's Harry Sandell. I'm from Liverpool, John Moores University. Thank you very much for a very rich talk. There's a lot to take in there. Apologies if I missed it, but I was wondering if any of your interviewees discussed how contact with the criminal justice system itself and national policy and structures was in itself a risk factor for drug involvement and escalation of drug use and drug problems.
Actually, in this presentation, we focus on not on the opinion of on young people on intervention and prevention, and of course also policies. That was part of another, maybe EPPIC and other Jacek later talks a little bit. But yes, I can say that they mention frequently the fact that the drugs are illegal. So in this sense, the issue of illegal and legal substances came out as one of the important issues in crime, of course.
Especially with reference to cannabis, most of the interviewees find it very not fair that everybody use it, but you have to get in troubles if you are caught with this drug.
Yes, I wondered, related to that, how important as a life event was the first contact with the criminal justice system? Did it seem to be just something that people expected, or was it a major turning point?
There were many different cases about this. In some cases, especially interviewees belonging to family with a history of legal problems, it was considered just like a consequence, expected consequence of their behaviors. But in other cases, it was like unexpected because of lack of awareness of what they were doing. For instance, I am thinking about students who started to sell to their close friends cannabis because they were brilliant with technologies, and so they discovered that it was so easy to buy them by the darknet. And so they constitute a buying group, but they were not really aware of what they were doing in terms of legal consequences. Indeed, for some interviewees, this contact with the criminal justice systems was very a breaking experience that changed in a way their existences and made them to reflect about problems that it can give you. But anyway, if they were more aware about the legal consequences, still they thought that, for instance, using cannabis was not so unhealthy or they think that it does implicate particular health issues or problems in doing what they are doing, for instance, studying or having a job.
Okay, Betsy, do you want to make a final comment?
There was.
Oh, there was. Can you see a hand?
Yeah.
Ah, good. This might be the last one then before the copy.
I was wondering if the legalization of cannabis in other parts of the world had any impact or made any differences over the course of your research. I recently went to, well, about a year ago, I went to California, and there are apps where you can order cannabis to be delivered to your door, and it is really normalizing. And I was wondering if you've seen that have an impact.
It would be really interesting to have to analyze these other kind of experiences in terms of impact on their lives, and yeah, I agree. But unfortunately, we didn't have data to reflect about this.
That was a future project.
Yeah.
Well, good. Well, thank you very much for starting off the day so well. That was absolutely fascinating, and congratulations again to you all. So we're going to break now for coffee. We have half an hour. Please look at the stalls, and then be back here promptly at 11:45. Thank you.
Check out the people I haven't met yet.
I said 3 hours, really? Really? It was very fast.